Bipolar disorder is a mood regulation that is characterized by cycling between extreme highs, also known as mania, and extreme lows, also known as depression. The first depression episode typically begins at the age of 18, and the first manic episode typically begins at the age of 24. Unfortunately, with this disorder, obtaining a correct bipolar diagnosis typically is delayed until the age of 33. There are 3 types of bipolar disorders. Bipolar disorder type 1 is known as the more severe type and is characterized by manic, depressive, or mixed moods. Psychotic symptoms occur about 50 to 90% of the time. Bipolar disorder type 2, there is no full-blown manic episodes. It is similar but limited to hypomanic states. Cyclothymia is the 3rd type, and it's a milder form where symptoms are too mild to meet a bipolar disorder diagnosis. Bipolar disorder is also associated with high rates of suicide. About 30% of people complete suicide during the depressive cycle. It is theorized that the cause may be related to neurotransmitter dysregulation or possibly abnormal permeability of postsynaptic membrane. Antidepressants cause rapid cycling, which rapid cycling is an occurrence of 4+ episodes of mania or depression in a 12-month period. Antihypertensive medications, corticosteroids, and other hormones, and drugs of abuse, and more can make symptoms worse. Those with bipolar disorder like the way they feel in their manic cycles. Manic episodes are similar to a high from an amphetamine. Symptoms during a manic episode include decreased sleep, excessive energy, feelings of euphoria, talkative, grandiosity, elevated libido, inability to concentrate, all of which can lead to poor judgment, impulsivity, reckless behaviors, excessive spending, substance abuse, and engaging in dangerous sexual activity. During a hypomanic episode, the symptoms are not as severe, and those with bipolar disorder are more likely to seek help during the depressive episode. Triggers often set off these symptoms, and for somebody who has bipolar disorder, they are really sensitive to triggers. Always remember that you are not alone. Keep fighting, brave fighter.